Welcome to HIMSS TV. I'm your host, Jonah Comstock. I'm joined today by a longtime member of the HIMSS extended family, Kate Milliken, who is back behind the camera after a bout with COVID-19. And she is going to talk to us a little bit and just share her patient story and how she was able to get the treatment she needed and beat the disease. Welcome to the show, Kate.
Jonah, I'm super psyched to be here. Thank you for having me. I feel like, we spend a lot of time talking about all the complexities of healthcare. And, once in a while, healthcare goes right. And I feel like for me, that ended up happening. A few weeks ago, I was with my daughter. My daughter spiked a fever on a Saturday. The moment she spiked a fever, I thought, uh-oh, she was diagnosed with COVID. And seeing as we had sat together and watched Survivor for 3 hours, I knew I was a sitting duck. And sure enough, 2 days later, I ended up getting a positive test of COVID, and my symptoms kind of manifested in a fever matrix. I spent about 8 days locked in a terrible headache and a fever that ranged from 99.5 to 102.6, and I really couldn't get out of it. And in about day 6 of it, I called a friend of mine who is a doctor. Her name is Dr. Melanie O'Neill. She's been working at a City MD in Long Island since last March, if not before. And I just emailed her and I said, "Do you have any advice for me?" And she said, "Yeah, my advice for you is to sleep on your stomach. And also, why don't you apply for monoclonal antibody treatment?" And the reason why she said this is because she knows I live with MS. And it's something that she, in her practice, has been able to prescribe. And the results for the people who meet the criteria have been nothing short of astonishing. I mean, she's had 2 patients that feel like she ended up saving their lives because they felt so much better. So I reached out to my primary care physician and I asked him whether or not it would be possible to apply for this treatment. And my PCP called me back and he said, "Actually, I don't think this is a good match. And that monoclonal antibody treatment is actually for people that have already made it to the hospital," which I happen to know from Dr. O'Neill, who's been boots on the ground, is not true. So I said to my PCP, "I actually think you're wrong. That it's actually created for people who are mildly sick, who have the potential of getting sicker." And to his credit, this primary care physician named Lokesh Reddy put down the phone, called my friend, ended up calling 2 heads of infectious disease at different hospitals. He was able to submit an application to 2 different places, and one of them accepted me for monoclonal antibody treatment. So I ended up going a couple days later to White Plains Hospital. I got the infusion, and 24 hours later, my fever dissipated, and I felt remarkably better. And I just had a moment of, when it was over, of how lucky I was to be able to know somebody to ask, kind of who's in the space, and to also have been lucky enough to have a doctor who was wrong, who, egotistically might have made a different choice and didn't. And the fact that these 2 practitioners worked together in the best interest of me just felt like it was so important to share a story like that. And I think in this time, more and more things like that are happening.
You have a lot of experience as a patient advocating for yourself, both as a person who lives with MS and also some of the professional work that you've done around rallying patient groups together and promoting patient empowerment. So, how does this experience sort of, can you put it in that context? Is this better or worse than what you've experienced in the past, trying to advocate for the right treatments and things like that?
I mean, this was an example that actually felt incredibly easy. I mean, I left this experience certainly being aware of how lucky I am and how I have been a health advocate, but it begged a bigger question. It's like, how do people who have to deal with their health know that they can be advocates? Find a network where they can end up being informed. I mean, Dr. O'Neill told me that she happens to know that the antibody treatment is wildly underused because people in certain environments just have no idea that they can apply for it and how to ask for it. So it's almost like that question gets thrown back to you of like, how do we make these moments where you can gain an understanding that you can get the potentially the same, antibody treatment as the president. How do you educate people to know that?
Yeah. And I mean, are there reasons that it's not being used more widely? Are there certain patient groups it's just not a good match for? Or is there an availability issue?
I believe that the criteria is fairly specific in terms of the people that can actually apply for it. I got it because I'm on an immune suppressant drug. But even with that criteria, I think that there's just a lack of awareness of how it works and what to do. And I think that my primary care physician, who I consider incredibly accomplished, is a wonderful example of somebody even on that level not knowing what's up. And it's all happening so fast.
Absolutely. Yeah. And there's a lot of information out there, and doctors are overtaxed just dealing with the patients that they have. So it's,
Well, my wonderful friend Dr. O'Neill called my other doctor a unicorn, which I thought was which was great, and I'm hopeful that, people in this time can really think about ways that they can help other people, and, kind of the power of communication, and trying to figure it out as a group too.
talk to me a little bit about the virus itself, and what it was like having it compared to what you maybe expected or what you had heard or read about, during this pandemic.
I had such abject terror about getting the virus. I was constantly freaking out about it. I know a lot of people who have been very sick with it, if not died. And one thing that was interesting is that once I got it, it actually became less scary. It was like, oh, you're in it, and certainly recognizing the unpredictability of it. What I can say viscerally about it is it felt like a relentless flu with a gravitational pull. I mean, it really did for me feel as if we were dealing with the beast that just wasn't 100% normal. So it did feel unusual. After I broke the fever, I had a number of days of like a lot of exhaustion, and that fatigue actually reminded me of the type of fatigue that you might have with MS. I mean, very, very all encompassing and dominating. So I do feel, and I'm mild. So I do feel that what people are experiencing is something that really does take you out of commission.
And you and your daughter are doing better now? Are you past it, or what's the?
Well, you'll be pleased to know that my daughter spiked a fever and was fine 12 hours later. I got it, then my husband got it, then my au pair got it, then my son got it. So we all have survived. We all manifested it in different ways. I was by far the worst. And now I'm like really excited to say that we may be the safest house to come visit in the neighborhood. So I invite anyone to come over, because the chances of you getting it from us are probably next to none. That's like the small benefit of having COVID.
Yeah.
At least for a couple weeks or months or whatever.
That vaccine is still so hard to come by. So you got the immunity the hard way.
Exactly.
So any tips for, not necessarily in your exact situation, but, patients who have taken the step of getting informed, they have an idea of what they need. Maybe they even have a doctor friend like you did, to get through, that those kind of systemic barriers and make their voice heard.
Honestly, Jonah, I just feel like I feel like there are a lot of people that come from a place of humility in the face of their doctor. And I can speak, a wonderful example is my mother. The older generation, my mother has something pressing that she's really worried about. And the soonest appointment she can get is in 2 weeks. And, she would never call that office and say, look, I really feel like I want to come in sooner. If there's a cancellation, I'm right there. Like, there's a way to ask for what you need. I feel like that doesn't have to be egregious. That can be positive, and also can, maybe make change. So I guess my advice would be that, if you're feeling like you don't know the answer and you're helpless and you're confused, that doing the best you can to find somebody who might know the answer and believing it's worth your time to investigate all options, and also believe that the person that you call is willing to help. And I think in the time of COVID, people really do want to help. I mean, you should have seen how many casseroles came to my door.
Well, that is great to hear, and it's obviously we're also glad that you're doing better and that you made it through this, Kate. And I hope that your experience will be a help to other folks who see this or hear about it from you and other ways and channels.
Yeah, thank you, Jonah. Well, I hope so too. And for anybody that is starting to experience COVID that may have certain conditions, I hope you will go look up monoclonal antibody treatment. There's one made by Eli Lilly, which is the one I got. There's another one made by Regeneron. I'm pretty sure they're quite comparable. And just to remember that, like, if you're unhappy, that it's worth trying to explore anything to make you a little bit happier.
Absolutely. There are options out there, and
There are options out there. That's right.
yeah, you can advocate for those. Well, thanks so much, Kate.
Thank you, Jonah.